It was very frustrating when we couldn't figure out what was wrong with Rachel. Like, she'd be sick, she'd always be tired, she'd have headaches, she'd wake up the next morning and she wouldn't be able to move. Her joints always hurt, not just her knees from playing soccer, but also her elbows and her fingers, and her back hurt too. And we'd go, and finally I'd say, okay, something's got to be wrong with her. We'd take her to the doctor, and they did all kinds of tests on her, and nothing was wrong with her.
I remember Rachel starting to get migraines whenever, I think it was about our freshman year in high school. And so like the headaches were just like really affecting her. Like she'd come to practice, you know, her head would be hurting, she wouldn't want to run, it was too bright out.
It was so frustrating because here you have a 14, 15, 16, 17-year-old girl who should be totally healthy, who's been playing sports her whole life, and she has all these problems and you can't figure out what's causing them. I guess the escalation point was soccer, because Rachel had gone from being a starter on her team, even doing the Olympic development team and making that team, to maybe the next year, you know, starting but, you know, having to fight for her position, to the next year not even starting but sitting on the bench, to the next year not even playing.
She thought it was because she just couldn't play soccer anymore, that she just wasn't trying hard enough, that she wasn't, you know, in shape enough. And like it was one of those things that you feel like you can control, that like you're like, well, if I just like I run harder, like I'll get more in shape, or if I do more trainings, if I, you know, play with the ball more, I'll get better, I'll come out of this. But like it never happened because it was out of her control, and she just like, she didn't know that at the time.
I was looking into anything and everything that could be causing Rachel's fibromyalgia, or causing her disease. I didn't know what was wrong with her, and nobody could tell me what was wrong with her. The doctors couldn't even tell me what was wrong with her. They can tell me that there was nothing wrong with her because every test we did showed that she was fine. I was looking online to see what it could be. I was looking up all the things they had done tests on, and that's when fibromyalgia popped up online. The biggest help was going to Dr. Frankovich. She is a pediatric rheumatologist, but she specializes in fibromyalgia. She's run through many cases with young teenagers that have had fibromyalgia, so she knows what needs to be done. And finally getting with somebody that knew what needed to be done was the best. So that was the best thing. And then her suggestions have helped a lot. One of the things she did is, in order to tell whether you have fibromyalgia, there actually is a minor test. Besides trying everything to see if anything's wrong with her and having everything come up that there's nothing wrong with you, there's also pressure points that fibromyalgia patients, there's 18 pressure points that fibromyalgia patients feel. And Rachel, the first time that she went in there, had 11 out of the 18.
Like emotionally, I feel like she's a lot better off now that she knows that she has fibromyalgia, and she's able to deal with it, and she's doing things to help make the symptoms less intense, because now like she's not having to go through the stress as well as all the physical things that she's feeling.
Fibromyalgia, in the Western term, I know that it's a diagnosis when you have a lot of muscle pain that can make you very tired. It's very painful, but the cause and the treatment is very kind of still developing.
Fibromyalgia is a little bit different in that it's not so much muscles and bones, but my thought is that there's a whole system in our body called the fascial system, and it's the connective tissue that connects all of our muscle fibers together. It connects and surrounds things like bones and tendons and ligaments, and it also connects our skin to what's underneath our skin, like our muscles and our bones. And this fascial system is really difficult to pick up on any kind of imaging. So one of the things you hear about fibromyalgia is there's not a lot of objective findings on x-rays, on MRIs, on CT scans, on blood work. You know, what exactly is fibromyalgia? And I think that it has to do with this system, because this system is really, really hard to objectively measure. Adrenaline is released in our fight or flight reactions or response to something that startles us or scares us. And that kind of hits on the sympathetic nervous system. It's the nervous system that controls the things that you don't have to think about, your heartbeat, your intestines doing their job. If there's a abnormal amount of adrenaline flowing through somebody's body, that can make them feel fatigued. And so if somebody, I guess with fibromyalgia, if there is an abnormal release of adrenaline, that can just give you that constant, after a game or after a really scary incident, feeling, which all of us know is a very tired feeling.
Well, definitely the emotional aspects are much better because we know, and her father and I can support her, and her sisters understand. The hardest thing for Rachel is when people don't understand what's going on, because when you look at her, she looks fine, you know, and on her good day, she could be hopping up and down and dancing and having a great time and nothing's wrong with her. And then the next day she's going to be hurting. So the hardest part for her is that her friends look at her and don't understand. And even she'll sometimes see her coaches and they'll look at her and say, well, Rachel, don't you want to play? And yeah, she wants to play. She can't play. So emotionally, it's very hard when people don't understand what's going on with her.
I think that with any chronic condition, over time, the mind comes in. Because with chronic pain, let's take that for instance, which fibromyalgia could almost be termed as a chronic pain. But after a while of dealing with this for years and years and years, if you're in your 60s and you've had fibromyalgia for 40 years, let's say, you know, there's going to be a part of you that doesn't want to get up in the morning. You're going to have almost depression-like symptoms. And that can only compound or, you know, make greater your symptoms of pain throughout the day.
We're on a quest right now because Rachel's going to be going to college next year. She's going to be far away, so we want to try to make sure we know what we can do for her before she leaves.
In terms of just fibromyalgia diagnosis, I get a handful like, you know, every year. What we see is we see the whole body, and instead of calling it fibromyalgia, we see what the balance is, because in Chinese medicine, for example, fibromyalgia, they can have two outcomes. One is based on cold and one is heat. So based on those two, we treat it differently. So it's basically a protocol, and there are a lot of different points in our body. In fact, in our textbook, there's over 300 points. The points I use are actually for clearing heat points. So usually the clearing heat points are located, you know, like at your knees, your elbows, things like that. And it's not about just kind of like giving relief, and you know, we want to treat the underlying causes. That's why, you know, we do diet recommendations, lifestyle changes, anything that people aren't aware of that's in their lifestyle may be contributing to the cause of the problem. What the acupuncture needles do is three things. First, it increases circulation in that area. So pain, a lot of times it's because the circulation is blocked. So your body's sending a signal like there's something blocked, you know, it needs to be moved. Secondly, it reduces inflammation. So a lot of times pain is caused because an area is inflamed. By opening circulation, the inflammation goes down. It also triggers the central nervous system to release endorphins, and endorphins is a natural painkiller. So sometimes people feel like the pain is gone, or they feel like kind of sore and heavy in the area the needle is, and people would ask me, oh, did you dip the needle in something? But there's nothing, it's your body reacting to the needles.
I've worked with several patients with fibromyalgia, from very, very moderate or minor to quite severe, and age ranges from teenagers to 60s. What I'm thinking of when I see somebody with that diagnosis is that they are going to be sensitive to being overworked. They may be sensitive to a lot of pressure on their body, and they may be constantly fatigued and tired. So I have to take that into consideration in developing an exercise program for them. I think that the benefits of exercise are well documented on all body systems. But I think with fibromyalgia specifically, exercise is known to increase the amount of our own natural body killers, which are your endorphins and enkephalins, these types of things. Exercise increases the amount of those that are flowing through our body. So if fibromyalgia is primarily a pain syndrome, then obviously exercise and increasing our body's natural painkillers is going to be very, very helpful.
Fibromyalgia, to me, actually, the word fibromyalgia to me is almost a relief, because I'd rather have a word associated with all of Rachel's symptoms than not at all, than keep going, what is causing this and why is this happening to her? So to me, fibromyalgia isn't a bad word, it's a good word. It's saying, okay, there's research being done on this. There are ways that you can work towards getting better, and hopefully more research will be done and there'll be ways to fix it in the future.
I hope that she gets better in the future and she's able to do things at her full potential, and that like everything will work out for her.
So yeah, I worry a lot about what the future's going to entail, but you know, I try not to think about that too much. I just think we take it day by day.